Have you ever woken up with that deep, stubborn ache in your lower back, the kind that makes you freeze for a second and wonder, is this just from sleeping wrong, or is my kidney trying to tell me something? Because here's the truth, most people never hear by the time kidney pain shows up. It's often already a red flag that your body's filtration system is under serious stress. Millions of Americans mistake warning signals from their kidneys for ordinary back pain, ignoring them until it's too late, until infection sets in, or a hidden stone turns into agony that lands them in the ER. And that's why today's talk is so important. I'm Dr. Johnny, and in the next few minutes, I'm going to show you exactly how to tell the difference, how to listen to your body's early whispers before they become screams. Stay with me, because what you learn here could mean the difference between a quick fix and a lifelong kidney problem you never saw coming. Most people point to their lower back and say, right here, doc, this has to be my kidney. But here's the shocker: in 8 out of 10 cases, that pain has nothing to do with your kidneys at all. It's your muscles, your spine, or even a pinched nerve screaming for attention. I remember one of my patients, Robert, a 58-year-old truck driver, who swore his kidneys were failing because of the ache he felt every time he sat behind the wheel. But after one simple test, we discovered his kidneys were perfectly fine. It was his posture that was killing him, not his kidneys. So how can you tell the difference? True kidney pain usually lives higher up, right under your ribs near the middle of your back, and it doesn't change when you twist or bend. It feels deep, almost internal, like a dull pressure you can't quite reach. Muscle pain, on the other hand, behaves like a moody teenager. It comes and goes, flares up when you move, and often shoots down one leg or both. According to the National Kidney Foundation, over 80% of back pain cases in adults are musculoskeletal, not renal. That means millions of people panic unnecessarily, thinking every twinge in their back is a kidney failure warning. Here's a simple comparison that helps my patients remember. Muscle pain reacts to motion, kidney pain reacts to trouble. If you move and the pain changes, that's your muscles talking. If you move and it stays exactly the same, deep and steady, that's when you start paying attention to your kidneys. But remember, our bodies love to play tricks on us. A pulled muscle can mimic a kidney ache and vice versa, especially if dehydration or infection is in the mix. That's why listening to where the pain starts and how it behaves can save you from endless guessing and Google panic. So next time you feel that ache crawling up your back, pause for a second and ask, does it shift when I move, or does it sit there like a stone? The answer could reveal more than you think. But just knowing this difference isn't enough, because there's another factor, one far more painful and far more dangerous, that most people never see coming. Now that you know how to tell kidney pain from muscle pain, let's talk about the number one culprit when that pain does come from your kidney stones. Kidney stones are like tiny bullets made of minerals and salts. And when they move, they don't just hurt, they dominate your entire world. I once had a patient, Linda, who described her pain as a knife twisting from the inside out. She was tough, a former marathon runner, yet that day she was curled up in my office chair, pale and sweating, whispering, Dr. Johnny, I'd rather give birth again than feel this. That's the power of a kidney stone. It forms quietly inside your kidneys, building layer by layer like mineral armor. But when it breaks loose and travels down the ureter, the narrow tube connecting the kidney to the bladder, the agony is almost unimaginable. You see, that tube isn't built to stretch much. So when a stone tries to squeeze through, it's like forcing a marble through a straw. The pressure rises, the kidney spasms, and the pain radiates from your flank down to your lower abdomen and even your groin. Medically speaking, about 1 in 10 Americans will experience a kidney stone in their lifetime. And once you've had one, the risk of getting another doubles. Dehydration, high sodium intake, and excess animal protein are the main villains. When your urine becomes too concentrated, calcium and oxalate crystals stick together, and that's when the trouble begins. Imagine sugar crystallizing at the bottom of a glass of tea. That's exactly what's happening inside your kidneys. If you've ever felt sudden, sharp waves of pain that come and go, sometimes making you nauseous or sweaty, that's your body fighting to push that stone out. And here's something most people don't realize: even a tiny 3mm stone can bring a grown adult to their knees. The kidneys have no mercy when they're blocked. So what can you do about it? Start with water, not soda, not juice, but plain water. Staying hydrated dilutes your urine and prevents those crystals from forming in the first place. If you've had stones before, talk to your doctor about limiting salt, cutting down on red meat, and adding citrate-rich foods like lemons and oranges, natural stone fighters that help neutralize acid levels. You can think of it like maintenance for your car. You wouldn't drive for months without changing your oil, right? Well, flushing your kidneys daily with water is your body's version of that oil change. A simple habit that could save you a trip to the ER. But even kidney stones aren't the only danger hiding in your back. Because sometimes the real threat doesn't come from a rock. It comes from an invisible invader slowly inflaming your kidneys from within. But just knowing this alone isn't enough, because there's another factor, one far more silent and far more destructive, that most people never notice until it's almost too late. If kidney stones are like bullets, kidney infections are the silent fire that burns from within. They don't always arrive with screaming pain. Sometimes they whisper first. A little fever, a dull ache near your ribs, a strange urge to pee again and again. Then suddenly that mild discomfort explodes into a full-blown fever, chills, and pain so deep it feels like your back is on fire. I once treated a nurse named Amanda who brushed off her symptoms for a week. Just a bladder infection, she said. But when her temperature hit 103 and her blood pressure dropped, she realized this was no ordinary infection. It had spread all the way to her kidneys. When we ran her labs, her white blood cell count was off the charts. One more day of delay and it could have turned into sepsis, a life-threatening blood infection that kills thousands each year. That's what makes kidney infections so deceptive. They start where you least expect, often as a simple urinary tract infection, UTI, that sneaks upward. Once bacteria reach the kidneys, they inflame the tissue, causing swelling and scarring that can permanently reduce kidney function. According to the Centers for Disease Control, CDC, more than 250,000 Americans are hospitalized annually due to severe kidney infections, and untreated cases can double your risk of chronic kidney disease later in life. So how do you protect yourself? Listen to your body early. Don't ignore symptoms like cloudy urine, burning when you pee, or that constant low-grade backache. Stay hydrated, practice good hygiene. And if you're prone to infections, consider probiotics or cranberry extract, both shown in clinical studies to lower UTI recurrence by supporting a healthy urinary microbiome. And if your fever rises, your side aches, or your energy suddenly crashes, don't wait. That's not just a UTI anymore. That's your kidneys waving a red flag. Because every hour you delay, those bacteria multiply and your risk of permanent damage rises. But even infection isn't the end of the story. There's another cause of kidney pain that doesn't come from bacteria or stones. It's something your body grows all by itself, quietly, relentlessly, until one day it's too large to ignore. But just knowing this alone isn't enough, because there's another factor, one that expands silently inside you, pressing against your organs until your kidneys scream for space. After infection, there's a different kind of threat, one that doesn't come from outside your body, but from within it. It's called polycystic kidney disease, or PKD. And it's as if your kidneys start turning against you, growing hundreds of fluid-filled cysts that slowly squeeze out their own function. These aren't the harmless little cysts many people have. Without ever knowing, these are massive expanding bubbles that can turn a kidney the size of your fist into something as big as a football. I remember Thomas, a retired teacher in his late 60s. He came to me complaining of a constant dull ache in his sides, tiredness, and a bloated belly. "Doc," he said, "I feel like there's something growing inside me." He was right. Both his kidneys were enlarged with cysts, each more than 10 centimeters wide. They were pressing against his intestines and even making it hard for him to breathe. What broke my heart was that Thomas thought it was just age catching up with him. In reality, his kidneys were fighting for space to exist. Polycystic kidney disease isn't rare. It affects about 1 in every 500 to 1,000 people worldwide, according to the National Kidney Foundation. It's usually inherited, passed down silently through generations. And what makes it cruel is how quietly it grows. Most patients don't even know they have it until they start noticing high blood pressure, fatigue, or back pain that refuses to fade. Inside those cysts are crowding out healthy tissue, reducing kidney function little by little until one day the filtration rate drops below the danger line. Science has made progress, though. Today, medications like tolvaptan can slow cyst growth in certain patients, buying valuable time before dialysis or transplant becomes necessary. Lifestyle changes, like keeping blood pressure under 120, avoiding salty foods, and staying hydrated, also play a major role in preserving what's left of kidney function. Think of your kidneys like two overworked balloons. Every bit of extra pressure, whether from sodium or dehydration, just makes them expand faster. If you have a family history of PKD, early screening through ultrasound or genetic testing can be life-saving. Because when caught early, you can manage it, but once the kidneys enlarge beyond control, there's no turning back. And that's why paying attention to your body's quiet warnings, the fullness in your side, the unexplained fatigue can make all the difference. But there's still one more cause of kidney pain, one that can strike anyone anytime without warning. It doesn't build up like stones, or creep in like infection, or grow like cysts. It happens in an instant, and it can change your life forever. But just knowing this alone isn't enough, because there's another factor, one that hits suddenly, brutally, and leaves no time to prepare. And then there's the kind of kidney pain that doesn't give you time to think. No slow warning sign, no gradual buildup, just one sudden crushing moment. A fall, a car crash, a hard tackle in a football game. It hits before you can even realize what's happening. 1 second you're fine. The next it feels like someone punched you straight through the back. I'll never forget Kevin, a 35-year-old construction worker who came into the ER after falling from a scaffold. He said, "Doc, I think I just bruised my back." But when we checked his scans, one of his kidneys was surrounded by blood, a hematoma pressing against it like a tightening fist. His blood pressure was dropping, and his skin had gone ghost white. We had to act fast. That's the terrifying part about kidney trauma. It can look minor on the outside, while your internal bleeding is quietly stealing your life away. According to research from the American Journal of Kidney Diseases, blunt force trauma from accidents, sports, or even heavy blows accounts for nearly 10% of all kidney-related hospitalizations. And here's what most people don't know. You don't need to break a rib to damage a kidney. Even a strong impact from a fall or car seat belt can rupture delicate tissue or blood vessels, causing internal pressure that triggers intense, deep pain. The signs can be subtle bruising on one side, blood in your urine, dizziness, or a constant dull ache that doesn't fade. If you've had any serious impact and notice these symptoms, don't try to tough it out. Go to the ER immediately. Your kidneys can heal from mild trauma, but only if the bleeding is controlled early. Wait too long and that simple bruise can turn into kidney failure or even permanent loss of the organ. In moments like these, time is everything. The body doesn't send second warnings. If you act fast, doctors can drain the bleeding, save the kidney, and stabilize your blood pressure. But if you wait, the damage becomes irreversible. And the truth is, many people lose one kidney not to disease, but to accidents they thought were no big deal. That's why knowing your body's danger signals isn't just smart, it's survival. Because whether the cause is trauma, stones infection, or disease, your kidneys only have one language: pain. And learning to understand it could save your life. But just knowing this alone isn't enough, because what you'll hear next isn't just about pain. It's about protection, healing, and how to make sure your kidneys stay strong for decades to come. You know, after walking through all these hidden causes, the stones that stab without warning, the infections that creep in, silence, the cysts that grow like unwanted guests, and the injuries that strike in a heartbeat, it's completely normal to feel a little uneasy. But don't let fear control the story. Let knowledge lead it. Fear freezes you. Awareness frees you. The moment you understand what your body's trying to say, you move from helpless to empowered. And that's where true healing begins. Your kidneys are incredible. They filter your entire blood supply about 50 times every single day, over 150 quarts of fluid, passing through, quietly removing waste, balancing minerals, and keeping your blood pressure steady. They never complain, never take a day off. Think about that. Every heartbeat you've ever had owes something to those two fist-sized organs sitting under your ribs. And yet we rarely thank them until they start to hurt. So here's what I want you to take away from today. Small, consistent actions protect you far more than any miracle pill. Drink enough water so your urine stays pale. Cut back on the salty snacks that silently raise your blood pressure. Watch your sugar, your weight, your stress, because each one adds pressure to your kidneys over time. Schedule routine checkups. Don't wait until symptoms shout. Prevention is boring, yes, until it saves your life. And I say this not as a doctor talking down to you, but as someone who's seen too many people realize too late that the back pain they ignored was actually a kidney crying for help. You don't have to be one of them. Take one step today. Maybe that's swapping soda for water, cooking one meal with less salt, or calling your doctor for a lab test you've been postponing. Your kidneys don't need perfection. They just need consistency. If this video gave you a spark of clarity, save it right now. Keep it in your health playlist so you can come back whenever you need a reminder. And before you scroll away, hit that subscribe button and turn on the notification bell, because each week I share new science-based tips, real patient stories, and easy recipes to help you care for your kidneys, heart, and overall health. Together, we're building a community of people who believe prevention is power. I read every comment you leave. So tell me below, what was the biggest aha moment for you today? Was it learning how to tell muscle pain from kidney pain? Or realizing how something as simple as dehydration could start a chain reaction? Your answers might help someone else who's reading right now and feels exactly like you did this morning. And as we wrap up, I want you to remember one simple truth. Your body isn't broken, it's talking. Every ache, every twinge, every change in your energy is your body's language of care. Listen early, act wisely, and you'll never have to face a crisis alone. I'm Dr. Johnny, and I'm truly grateful you spent this time learning with me. Take care of yourself the way your kidneys take care of you, quietly, faithfully, every single day. Stay strong, stay hydrated, and I'll see you in the next video where we'll dive even deeper into how to keep your kidneys and your life flowing clean and healthy.